Another way in which we, Erie County, are protecting the public's health is addressing the terrible opiate addiction epidemic facing our community. As we have all learned recently, opiates are powerful drugs that are highly addictive and run the gamut from pain pills like hydrocodone, OxyContin, Vicodin, Loratab, and street drugs like heroin and fentanyl. As our public health department knows, these drugs are non-discriminatory. They affect poor inner-city youth, blue-collar rural families, as well as wealthy professional suburbanites. Every community in our county has been touched by this terrible scourge. These drugs kill. People of all ages and races are dying from these drugs, whether they die with a needle in their arm or a pill bottle at their side. In fact, during one 10-day period earlier this year, 23 individuals died from opiate overdoses, and they ranged in age from 20 to 61. That is just one reason why the Erie County Department of Health has led the efforts to address this problem. From holding educational seminars for doctors on proper opiate prescriptions, practices, to training first responders and community members in the administration of Narcan. The members of our health department are working very hard every day to save lives and prevent others from being addicted to these drugs. But there's more that can be done. That is why I declared the opiate epidemic a public health crisis and created the Opiate Addiction Task Force to help our departments of health and mental health coordinate a community-wide response to this crisis. The task force has been charged with many goals, such as helping Erie County develop new community-based paradigms for treatment, to assisting families of those addicted cope with the addiction. One need that has come to light already, even before the first meeting of the task force, but reassured then, was we need a central screening, information, and referral line. This service would provide law enforcement, ER doctors, and families with a central hub to link addicts with treatment. Working with our long-term partners at Crisis Services, the Department of Mental Health has developed a plan to provide Erie County with this critical service. We also recognize the need for dedicated staff to support the Department of Health's rapidly expanding role as a lead agency in the fight against opiate addictions. These staff will monitor the use and distribution of Narcan, managing an ever-growing network of prescription drug drop-off kiosks, and coordinate the activities and projects of the Opiate Epidemic Task Force. This is a long-term fight that is worthy of allocations. As such, I will be sending over next week a proposal to address these critical needs and call on the legislature to pass this resolution as soon as possible. Doing so will make a difference. We cannot say that a problem exists and we need to address it, then reject funding for the programs that can help reduce the problem. So I ask my partners in government to approve this funding so we can help make a difference in lives, thereby saving lives in the process. Additionally,